Good afternoon. The YCS family, just like as we see in the country and in the world, has been deeply impacted by COVID-19. More than 25 million in the United States has contracted the virus, and over 425,000 people have died. And we know that Latino, Indigenous, and Black people in America are dying at higher rates of COVID-19. And we know we can't beat this virus without having a plan. Having a plan to beat this virus is simply the right thing to do. For YCS and on a national level, the plan to get through this is testing, treatment, continuing mask wearing, and vaccination. We are so fortunate to have access to the vaccine because the governor had placed YCS in a 1A category because of our congregate care facilities. While so many people are desperate to get the vaccine, we are incredibly fortunate that we have immediate access to it. But at the same time, we understand that there are staff that are hesitant to get it. And that's why we've given you the chance to ask your questions. We're recording this discussion so that we can answer your questions and further explain the importance of receiving the vaccine and to dispel any misinformation that may be out there. You have all put your lives on the line for nearly a year now to take care of our clients. You may have been in isolation with our clients, and at the same time, you may even have been in quarantine away from your own families. This vaccine is going to give us a chance to return to a normal way of life. I'm happy to report that 262 employees and 67 clients have received the first dose of the vaccine in Summerdale and in Hackensack. This is a great beginning, but this is just about 25% of all of our staff. So we have a long way to go. In order to defeat this national pandemic, the CDC says we have to establish herd immunity. And that means that 70% of the population needs to be vaccinated. Tomorrow, I'll be headed to Summerdale to receive my second dose of the vaccine. And I'm doing this because I believe it's my civic responsibility and a moral imperative. Now I'd like to turn over the discussion to Dr. Sharon Mason-Bell.
Hello. I'd like to just share that I made my decision to get vaccinated. I've had both my doses now, and it was both a clinical and personal decision. I felt it was necessary to protect myself, my family, everyone I work with here at YCS, the clients, and people in my community. The benefits of the vaccine well outweigh the risk of getting the disease, of being infected, because even those who survive the COVID infection may experience some serious long-term effects, including trouble breathing, fatigue, depression, heart muscle inflammation, sustained headaches, memory issues, brain fog, recurring fevers. The list is quite significant. The side effects of the vaccine are generally very short-lived, simple discomfort, either at the injection site, maybe a little tiredness for the day. And also it's been noted that have symptoms from the injection when you get the second injection, because now you have the first injection inside your body working and doing its job. So one way to decrease even that is to take Tylenol, not Motrin, but to take Tylenol either just before you have the injection or afterwards, just to put off those possible discomfort. The vaccine itself is quite safe because it does not contain any virus. It is not injecting any virus into your body. It does not change any of your own DNA, RNA, any of your genetic material. And it just gives your body the ability to recognize what the virus looks like so that it can mount a attack on the virus. Now I'd like to turn it over to Mr. Larry Bernard.
Good afternoon. Early on, the coronavirus found me. I started out feeling like I was getting a cold or that my allergies were kicking in. That wasn't the case. I started having a low-grade fever, some breathing issues, and was totally sapped of energy. This lasted for a good period of time, and there was no clear path to feeling better. This went on for about 14 days. Then I tested negative for the virus, but the story didn't end there. It took a good 2 to 3 months before I felt like I had my strength and stamina back. From a cognitive point of view, there are times during the day that I still feel like a deer in headlights. My wife would say, I'm suffering from COVID. That is why when I heard that YCS was able to get our consumers and staff vaccinated, I couldn't stop talking to my peers about how important it is to get the vaccine. To have the ability to avoid getting this virus, enough said. Last Saturday, I went to the YCS office in Hackensack to get the vaccine. Our staff were all working on keeping a safe physical space. The nursing staff did a wonderful job in making sure everyone felt comfortable, and the folks from the foundation made us feel welcome. It was a safe environment. I now would like to read questions and direct them to either Tara or Dr. Mason-Bell. Dr. Mason-Bell, you get the first question. How safe is taking the vaccine if you have or are taking medication for high blood pressure?
It is much safer than getting the disease. If the vaccine is not a problem for people who have other medical issues, but however, the infection is. It's, we've heard it all over that people who have underlying disease states have a higher likelihood of having a severe course of infection and a higher probability of dying. That is not the case for having the vaccine. There is a caution for people who have a history of anaphylaxis, which is an extreme allergic reaction, but even that occurs very infrequently, and we haven't lost anyone who's had that reaction. They just get the treatment for it and survive. So it is very important that even if you have underlying medical issues, you should get vaccinated if you can.
Second question is for Tara. I'm covered under my husband's insurance. Is there any cost to take the vaccine?
No, there is no cost to have the vaccine through YCS. In the paperwork that nursing has asked, they ask for your insurance card. You could send that over, but there is not a cost to it. And if you don't have insurance, you can just indicate that you don't have it.
Tara gets the third question. Will there be enough vaccine for a second dose?
Yes, there will be enough. We are very fortunate to have this partnership with CVS, and they have earmarked the number of doses we need to make sure that everybody who wants the vaccine can get both doses.
Dr. Mason-Bell, what if I can't make the clinic for the second dose? Can I go to a clinic at a later date in the same region?
Well, it is highly recommended for the Pfizer dose that we are receiving here at YCS that the second dose is given within the 21-day period. However, if something prevents that to happen, you can certainly contact depending on which region you got the dose from, Kyle in the southern region or Dina in the northern region, to schedule a time for you to get your second vaccination, as long as that occurs within 60 days of the first vaccination, it will still be effective. So we want to try to get it as close to that 21-day time period as possible, but you do have some leeway.
Tara, if I have side effects more than a sore arm or headache, do I have to report that to nursing?
You don't have to report that to nursing, but if you need nursing assistance, Kyle and Zena are here and available to you, certainly. What I can say from personal experience is that after the first dose, I didn't have any side effects, and most of the people that I spoke to didn't as well. I know that as Dr. Mason Bell alluded to earlier, there's a little bit more of a side effect, I believe, on the second dose. I'll let you know after Friday. But taking Tylenol ahead of time or immediately after does help. And if you have any problems, the nursing team is here and available to you.
The last bunch of questions will be for Dr. Mason Bell. Can you catch COVID from taking the vaccine? And do you have to quarantine for 2 weeks after getting the shot?
All righty. So no, you cannot catch COVID from the vaccine because the vaccine does not have any virus, and therefore you do not need to quarantine or isolate after being vaccinated. It is encouraged that you continue to use your PPEs, to keep wearing the mask when you're in the presence of other people, but that's just, part of our staying safe.
Next to last question. I am a diabetic and had COVID towards the end of November and all through December. Will I need any clearance from my primary doctor in order to receive the vaccine through YCS?
Okay, no, you would not. As long as you've been free of active symptoms for at least 2 weeks prior to the time that you would be getting the vaccine, you are cleared to get the vaccine. And that's whether those symptoms occurred before you had your first vaccine, or if it happens between your first and your second dose. As long as you are 2 weeks clear of symptoms, you are cleared to have the vaccine.
And the last question. I've been wanting to get the vaccine. However, I've been uncertain due to my current situation. I gave birth to my baby back in April of 2020, and I'm still breastfeeding. I've been looking for research and asking my doctors and colleagues in the medical field. However, I'm not sure what would be the effect on my baby. I don't even know if the benefits will outweigh the risk of getting the vaccine. Will it be safe to get the vaccine while breastfeeding?
It is best that you do discuss this with your personal physician to discuss the possible risks and benefits. There have not been extensive research on how this might impact a pregnant woman or a mother breastfeeding her child. However, the fact that the vaccine does not contain a virus, there is no concern about spreading, the disease or a virus to the child. It just really depends on the health of the mother. So really should discuss it with your physician. However, in general, it's encouraged that you do get vaccinated if you are in the group that it is being recommended, say healthcare workers, our 1A groups, things like that. You really should probably get the vaccination.
We'd like to thank everyone who submitted questions. Now to Kara.
Thank you so much. In closing, I just really want to send out a sincere thank you to Kyle and Dina for all the coordination, working so diligently to set up these clinics. They've been on the front lines since the start of this pandemic, and they've kept us all abreast of any new medical information and how to protect ourselves from the virus, and of course, providing us with vaccine updates. Lastly, I'd really like to thank Dr. Sharon Mason-Bell and Larry Bernard for participating in this discussion today. I hope that we've been able to answer your questions and allay any fears that you may have. If you still have questions, certainly please don't hesitate to reach out to us or to the nursing department. I did want to remind everybody that this Friday, January 29th, 10 to 4, you can head down to Summerdale for your vaccine, your free vaccine with snacks. We all need to do our part, as we've talked about, and you can get your first dose, or if you're due for your second dose, then you can get your second dose, and I will see you there. And then, of course, on February 13th is the second round in Hackensack, also from 10 to 4. And that would be your last chance to get your first dose of the vaccine through YCS. So we please encourage everybody to participate in this. We actually all, it was nice to even see people and be in front of everybody to get this vaccine. And this is our surefire way to help beat this pandemic. Thank you, everybody, for participating and thinking about this as a critical issue for ourselves and for our communities.